Nearly 18 million Americans take this blood pressure pill every single day. The FDA label lists swelling of the gums as a documented side effect.
As you can see
Most
on the
people
screen,
taking it have
everything
no
looks
idea their
perfectly normal
dentist might be
here.
seeing the consequences of their heart medication,
All
and
right,
neither
just
does the
hold still for
dentist.
me.
High blood pressure is one of the most common medical conditions in the United States. And for the roughly 18 million Americans who take amlodipine every day, it is also one of the most quietly managed. The pill works, blood pressure comes down, the prescription renews automatically, and life goes on without much conversation about what else the medication is doing. Amlodipine belongs to a class of drugs called calcium channel blockers. Calcium plays a role in how muscles contract, including the smooth muscle that lines blood vessel walls. When calcium flows into those muscle cells, the vessels tighten. Tighter vessels, higher pressure.
The vessel
Amlodipine
wall
blocks
slowly
calcium from entering
relaxes
those muscle
and
cells.
opens.
The vessels relax, the pressure drops. Clean mechanism, effective result. But calcium channel blockers do not only affect blood vessel walls, they affect other tissues in the body that also respond to calcium signals, including, in ways that most patients and even most doctors rarely connect, the gum tissue in the mouth. The FDA label for amlodipine lists gingival hyperplasia as a documented side effect.
As we
Gingival
zoom in,
hyperplasia means
we
the
can
gums
observe
grow
the cross-section of
abnormally,
healthy gum
progressively,
tissue
in ways
and
that
its
normal oral
attachments to
hygiene
the
does not
tooth
explain
enamel.
and cannot prevent. Not in a minor way that can be dismissed. In some patients, after months or years on amlodipine, the gum tissue begins to thicken and expand. It covers more of the tooth surface than it should. The gums become swollen, tender to the touch, and prone to bleeding when eating or brushing. The space between the teeth and gums, which should be clean and tight, becomes a pocket where bacteria accumulate. In more advanced cases, the overgrowth becomes severe enough that eating is uncomfortable, speech is affected, and the appearance of the teeth changes completely. Surgical removal of the excess gum tissue is sometimes the only solution. And if the medication continues, the overgrowth can return. This side effect has been recognized in the medical literature since 1994. Research suggests it affects approximately 3% of long-term amlodipine users, a figure that likely underestimates the real number because mild cases go unrecognized. It is listed in the official prescribing information under gastrointestinal side effects, which seems an odd category for a dental problem, but that is where the FDA places it. And yet, the vast majority of people who develop gum overgrowth on amlodipine have no idea their blood pressure medication is the cause. They go to the
Three,
dentist. The dentist sees the swollen gums. The
three,
dentist asks about brushing
two,
habits, about
4.
flossing, perhaps
Lingual
suggests more frequent
2,
cleanings,
3,
perhaps attributes the problem
3.
to genetics or age. The blood pressure medication prescribed by the cardiologist and the gum problem treated by the dentist occupy two completely separate conversations. Nobody connects them because nobody is in both rooms at the same time, and the person in the middle, swallowing their pill every morning, sitting in the dental chair every 6 months, has no idea the two are related. If someone you know takes this medication and has been told their gums are a problem, stay with this. The next few minutes may change a conversation they need to have. But gum overgrowth, while striking and well documented, is not the most common long-term effect of amlodipine that patients actually experience. The most common one is far more familiar: swelling, peripheral edema, fluid accumulation in the lower legs, ankles, and feet is one of the most consistently reported side effects of amlodipine over time. Here is how it happens. When amlodipine relaxes blood vessel walls, it does so more powerfully on the arteries than on the veins. Arteries carry blood away from the heart to the body's tissues. Veins return that blood back toward the heart. When the arteries relax significantly, more blood is pushed into the small blood vessels of the lower extremities. But because the veins do not relax to the same degree, they cannot return that blood as efficiently as it arrives. The excess fluid leaks out of the small vessels and into the surrounding tissue. The result, Western Mermaseri could be through visible swelling in the ankles and feet that worsens as the day progresses. Shoes that fit comfortably in the morning, that feel tight by the afternoon. A heaviness and ache in the lower legs that makes standing uncomfortable and walking more effortful than it should be. For many patients, this swelling begins within the first weeks of starting the medication. For others, it develops so gradually over months or years that it becomes the new normal before anyone thinks to question it. It is attributed to heat, to standing too long, to getting older. The medication is almost never the first explanation that comes to mind, because nobody said it could happen when the prescription was first written. The swelling itself is generally not dangerous, but it affects daily comfort significantly. And it can complicate clinical assessments because swollen ankles are also a sign of heart failure, kidney problems, and other serious conditions. When a doctor sees ankle swelling in a patient on amlodipine, sorting out the cause requires thinking about the medication. That thought does not always happen. Beyond swelling and gums, the label identifies several other effects that develop over time in some patients. Fatigue, headache, flushing, dizziness, particularly when standing up quickly. These are listed as common side effects occurring in more than 1% of patients in clinical trials, which sounds small until you remember that nearly 18 million Americans take this medication. 1% of 18 million is 180,000 people, experiencing fatigue, experiencing dizziness, experiencing headaches, attributing them to stress, to age, to the heat, to everything except the medication. There is also a heart-related consideration worth understanding. Amlodipine is primarily designed to relax arteries, not to regulate the heartbeat. But in some patients, particularly those at higher cardiovascular risk, the drop in blood pressure that amlodipine creates can cause the heart to beat faster to compensate. Called reflex tachycardia, this response is the heart trying to maintain adequate blood flow as the pressure in the vessels drops. For someone with an already stressed cardiovascular system, an elevated resting heart rate that persists over months is not trivial. The label notes cardiac side effects, including arrhythmia in rare cases. Monitoring heart rate, not just blood pressure, during long-term amlodipine treatment is a conversation worth having. None of this means amlodipine is the wrong choice. For many patients with high blood pressure, it is one of the most effective and best tolerated medications available. What it means is that the effects of taking it every day for life are broader than most patients are told when the prescription is first written. For leg swelling, elevating the legs during rest, reducing sodium intake, and moderate walking are commonly discussed as ways to reduce fluid accumulation in patients on calcium channel blockers. Some doctors discuss switching to a different class of blood pressure medication when swelling significantly affects quality of life, or adding a low dose of a different medication to counteract the fluid accumulation effect. For gum health, more frequent dental cleanings, every 3 to 4 months rather than every 6, are commonly recommended for long-term amlodipine users by dentists who are aware of the connection. The most important step, and the one that happens least often, is making sure the dentist and the prescribing doctor are aware of each other's findings. And the questions worth bringing to the next appointment. Has anyone talked to me about gum changes as a possible side effect of this medication? Is the swelling in my legs related to this pill? And is there anything we can do about it? Is there a different blood pressure medication that might produce less fluid accumulation for my situation? Is my heart rate being monitored alongside my blood pressure? These are straightforward questions. They are the questions of someone who understands that a pill taken every day for life deserves full information, not just a refill. When was the last time your doctor asked about your ankles? Subscribe to MedTruths and keep asking questions they forget to ask. Here is the truth about amlodipine. It works by relaxing the walls of blood vessels, and it does that job reliably for the nearly 18 million Americans who take it every day. But relaxing those vessel walls has consequences that extend beyond the numbers on a blood pressure cuff. Fluid that accumulates in the lower legs and ankles by the end of every day, dismissed as aging, as heat, as just how things are now. Gum tissue that thickens slowly over months and years, seen clearly by the dentist, never connected to the cardiologist's prescription. A link between a cardiovascular medication and a dental problem that is missed by every professional involved, because nobody is looking across both rooms at the same time. And the person in the middle, taking their pill, going to their appointments, living with their symptoms, never told that a single conversation with the right information could explain all of it. That connection is in the label. It has been in the research since 1994. It has always been there. You just needed someone to read it out loud.